My name is Dr. Timothy Thomason, and I'm going to explain how we do sinuplasty to relieve sinus problems. This diagram shows the position of the sinuses. You can see the frontal sinuses, which are in your forehead area, are in green. The ethmoid sinuses kind of run between your eyes. That's a series of small chambers. And the larger maxillary sinuses are in blue. That's in your cheekbone area. And then there's a larger one in the back called the sphenoid sinus, which is shown in yellow. The image on your right there is a actual CT scan showing the same position of the sinuses. The triangular black areas are the maxillary sinuses, which correspond to the blue areas on the diagram. And you can see the arrows point to the outflow tracts of the maxillary sinuses, which are teeny tiny, literally about a millimeter in diameter. This is a similar view, although on this sinus CT scan you can see that the sinus cavities have some inflammation. That's that gray tissue that you see, that it forms a rim around the maxillary sinus, and you can see that the outflow tract there is obstructed. We have a new technique that allows us to open these blocked sinuses called sinuplasty, and it's different than surgery because there's no removal of tissue. It's much less invasive. Usually it is done with topical anesthesia just in the office, and it's a quick procedure. In the last several years there have been probably more than 300,000 people who've had it done, and it works. There's good studies that show that it decreases symptom scores, and people who have a lot of blockage on their CT scans, years later the blockage is gone. So it not only does it work, but it seems to last for years. This diagram shows the first step of the procedure, and after the patient is anesthetized either with general anesthesia or with, if it's done in the office, just with topical and local anesthesia. You can see this little hook-shaped device is inserted, and we use an endoscope so we can see what we're doing, and a wire is advanced into the sinus. Next, this balloon is advanced over the wire, and then the balloon is inflated, and this is similar to angioplasty, and that tiny opening in the top corner of the maxillary sinus is now widened about tenfold. After the dilation is done, a lot of times there's a lot of secretions that come out of the sinus, so you can suction those out. Sometimes we'll irrigate them out with saline irrigation. Patients usually get a lot of instant relief when they're severely blocked. Once we're done, everything is removed, and you can see that the sinus is now quite a bit more open than it was, and there's nothing left in place. Some people kind of have a misconception that the balloons are left in place or there's wires left in place. Everything is removed. In fact, there's no packing or anything, so people can breathe well right after the procedure is done, and that's one reason why the recovery is so quick. This is a video of a patient that we just did recently in our office, and the patient already had anesthesia applied, and this is done awake. You can see the device is being inserted, and then the wire is passed and the balloon is passed, and now the balloon is being inflated. And we usually do a second inflation. This is just about done, and then it's removed, and that's how quick it is. A lot of people are real apprehensive about having a procedure done when they're awake, and it can be done under general anesthesia, but most patients do really well. We just give them a Valium beforehand. It makes you very relaxed, and we use a topical anesthetic gel, and that makes the inside of the nasal cavity very numb. And then we do some injections as well, which makes it even more numb. You really can't feel the injections because of the effect of the gel that was in place. And the anesthetic lasts about an hour. When it does wear off, patients sometimes have some burning pain or pressure, which is controlled with just over-the-counter pain medicine, or in rare cases we give them prescription pain medicine if patients need it. So there you have it. The procedure takes about an hour in total, but most of that is prep time. The actual procedure is about 10 or 15 minutes. Then we observe patients for about 10 or 15 minutes when we're done. Most patients do have a little bit of sinus pain or pressure right afterwards. Some people don't have any pain at all, which is interesting, but most people do have some. But we just give them Tylenol and ibuprofen, and they go home, take a nap, and really by the time they wake up, they're done. They're back to normal activities the next day. Patients can return to work or school the next day. They can't do anything strenuous for about 48 hours just because there's a small chance of having some nose bleeding. You might have noticed there's a little bit of bleeding during the procedure. Most people lose about a teaspoon of blood in total, and that's very minimal. And you might have a little bit of blood-tinged drainage if they blow their nose for the next couple of weeks. That's just normal part of the healing. But it's really a very quick recovery, and that's one reason why it's become so popular. We've really been pleased with how well this works. I was a little bit skeptical initially. I thought that more extensive surgery would be required, but it does work. The vast majority of our patients, probably 90% or more, come back and their pressure's better and their congestion is better, and it really does work well. Don't take my word for it. You can go to our website, dfwsinusrelief.com. We have a section on patient reviews, and you can read for yourself what people have said. These are actual people who've had the procedure done, and just about everybody says that they would recommend it for a friend or a loved one who had similar types of sinus problems. And that's, it's not everybody has that great response, but the vast majority do. So we've been very pleased with how well this works. Thanks so much for watching this video. I hope it was informative. And if you're in the Dallas-Fort Worth area and you are a sinus sufferer, as many people are, or if you know someone who is, a loved one or friend, tell them about us. Let us know. We have lots of things that we can do to help in almost every situation. Thanks.